Thank you for joining us virtually today. This is the International SOS COVID-19 update, and I'm very pleased to be joined today by Dr. Kate O'Reilly. We're going to have a look at a number of issues today, primarily around the update, what's happening around the globe with COVID-19, and secondly, answering a number of frequently asked questions that you've raised to a number of panels over the last few weeks. So let's start off with that update. Let's have a look at what's happening in the world of COVID-19. Dr. Kate, can I hand over to you, and will you take us through the initial update over the last week?
Yeah, sure. Thanks, Mike. So case numbers, we're now at over 2.4 million cases worldwide, and 165,000 deaths. The United States has the most number of cases. They have over 750,000 cases now, and then closely followed by Europe, Spain, Italy, France, Germany, and the United Kingdom. And we have seen that, this has evolved over the last couple of weeks, with some countries having higher death rates than others, but the cases climbing in all of them. Worldwide, there's now over 185 countries affected, and China just recently announced that they had adjusted the number of deaths. It was actually a 50% increase because they had counted their community deaths in the total. So we are still seeing the outbreak continue to climb and increase and affect other countries. And we are seeing a little bit now of slowing in Europe, where cases, although still going up, have started to slow and plateau. Lovely.
Thanks, Dr. Kate. That's much appreciated. Let's shift gears slightly and let's move into the world of this frequently asked questions. And obviously, this covers quite a range in terms of A, what's happening, and B, where do we go and what does the future look like? So maybe just to start to sort of cover off some of those grey areas. The first question we've had in is, can face masks help slowing the spread of the virus, and how useful are homemade masks or face coverings? Kate, can you cover this one for us?
I think it's important to note that the guidance and requirements for the use of face masks and cloth masks that cover the nose and mouth varies greatly. So in some locations, we've seen authorities requiring or recommending that everyone wear a face mask, and in other locations, authorities recommending against the use of face masks in public. The WHO have been quite clear in advising that they do not recommend the wide use of masks by healthy people in the community, because they don't feel that there's good solid evidence to support this, and it may carry a risk. We've often seen that when people wear face masks, then they stop doing other measures that are really important, like not touching their face, not washing their hands as frequently, and social distancing is kind of not kept to as well as it should. So there are definitely reasons not to, but equally, there is some evidence that actually using a face mask in the community could be considered and can actually protect others from people who are not displaying symptoms but may have the virus. So, for people who are out, say at the grocery store or on public transport, it may have a role. And the ECDC have said that, that is an appropriate use of face masks. I think we also need to be very clear that there is a shortage of masks, and medical face masks need to be preserved for healthcare workers, but people must follow local regulations and requirements when making their decisions about masks. Thanks, Mike.
Yeah, thanks, Kate. That's much appreciated. The next question that we are looking at is basically, how should organisations be approaching duty of care post-COVID-19 and when we return to a business as usual? I guess most importantly around this one is organisations are clearly trying to address this on a proactive basis. The current situation that we see where we have an altered environment is not unusual in the world of business, and historically we have seen periodical events such as natural disasters and civil unrest, previous pandemics, where we've had to adopt alternative measures to protect the workforce. The current COVID-19 situation doesn't change that. It's no different from the measures that you might take on a business planning basis. And the emphasis still clearly around the health and well-being of your workforce and understanding the demands of that workforce and how we make sure they feel that they're safe and they're well informed. Our advice, as it be during any crisis or incident, is to review your existing policies, assess them relative to the relevance to this current event, and then refresh them. And refresh them on the basis that address the concerns of the workforce, make sure you're implementing measures that are supporting that workforce, and look at increased communication around the workforce, especially around things like emotional support, EAP services, training your line managers to be better able to deal with this new environment of working effectively, coordinating, managing, and supporting a remotely deployed workforce. We're likely to be in this situation for a few weeks to come, and hence your young managers will need support with this. It is a changed environment, and training them is it's a good time now, and it'll have enormous impact on the organization. Moving on to the next area, and the next frequently asked question, are there any lessons being learned or knowledge shared from countries that have been deemed to manage the pandemic more effectively? Kate, I think this is definitely in your ballpark, if I can hand over to you.
I think countries have implemented measures, looking at their population, the way their population behaves, what's available to them in terms of testing. And so each country has had a slightly different approach. We've seen, some countries implement a very strict lockdown measures, and others take what we might call a more relaxed view. And it's very difficult to say at this stage, what has worked for one and what might not have worked for another are the correct strategies. I think we all recognise that social distancing is extremely important and something that has been implemented in most countries and has been shown to have a good effect. I think it will be interesting to see as cases slow in lots of countries, especially in Europe, how then the lockdown situation is eased to get people back to work and to get businesses up and running. So I think we, in terms of effective, those countries that have tested a lot seem to have managed to find cases and isolate them, and social distancing appears to be working well in all countries that have implemented it.
Lovely, thank you. So moving on to the fourth question, after a lockdown, how big is the chance of COVID-19 virus reappearing again? I'll pick up this one perhaps. I mean, from a historical point of view, and looking at events such as the 1919 pandemic, 1957, 1968, there is a strong chance that we're going to see potentially second, third, or even fourth waves. And it's very much influenced by the immunity across the population and the conditions that will allow the virus to return. In some of the historical pandemic cases, it's returned for 4 years following the event. So we need to be aware that it is about protecting the workforce and protecting the population. It is, of course, impossible to predict how significant those waves will be. But certainly advice that we would have at the moment is plan for the opportunity of there being further waves and ensure then that once you've planned for that, that your organization is going to remain more resilient in managing those events as they occur. We've spoken a lot about the pandemic curve and how it is important to reference that as a map for an organization relative to how you're planning to that return to a more normal position, and understanding that that pandemic curve is going to be different in the location that your individual within your workforce is traveling from, as well as where they're traveling to. It certainly suggests that different preventative measures need to be put in place depending on the situation your workforce faces, but also understanding that workforce and understanding that we're not returning to business as usual, we're perhaps returning to a business as unexpected environment relative to immunity, the risk profile that individuals have within your workforce. And you cannot look at your workforce as a single global mass. They will have individual different risk profiles. We need to be aware of that. We need to plan accordingly for it. We then need to look at exposure, available testing, and vaccinations that may be available at some point in the future, which is going to make the whole return to work much easier in terms of ensuring that you have minimized that risk as far as possible. Moving on to the next question, we're looking then at what are the testing options, the pros and cons of each one, and when are we likely to see a vaccination created? Kate, definitely for you.
Well, I think let's start with testing. Each country has determined its own criteria about who is tested and how they are tested. And so I think that that's an important differentiator when also looking at case numbers, to realise that people are testing in different ways and have different criteria about who gets tested. Then at the moment, there's kind of two types of tests. There's what we call the gold standard test, which is a test that is done usually in hospital, or at least needs to be done and sent to a laboratory. And these are usually swabs taken from the throat or the nose, and they take a while to process. And these tell you if you have got the virus. So if you currently have the virus and you have one of these tests, it will tell you whether you are infected or not. We then have the tests which I think we've all read a lot about, and they're often called rapid diagnostic tests, which are tests that are becoming more available to say whether you have had the virus in the past. So these look at your antibodies and tell you whether you've actually had it. So they don't tell you whether you've currently got it, they tell you if you've had it in the past. And they are much quicker to do and often just rely on a drop of blood, kind of a pinprick. So, so very efficient and really useful. However, there has been a shortage of the reagents. Not all of them are specific or sensitive enough. So you get a lot of false readings. So they are definitely tests that are coming our way, but are not in regular use at the moment, just because there is not a sufficient volume of them. And I think that being able to differentiate between the, if you've currently got it or you've had it, will be a really useful thing. We also wanted to talk a little bit about vaccines. So there's currently no vaccine for COVID-19, and there actually has never been a vaccine for a coronavirus. And we've seen previous infections. So we've had SARS and we've got Middle East respiratory syndrome, which is still in circulation. Neither of these have a vaccine made against them. So there is a lot of work being done to get a vaccine. Usually vaccines can take 2 or 3 years. It's not unusual to take that amount of time. This has been, I would call it, fast-tracked. So there's lots of scientists globally all working to try and find a vaccine. However, it will still need to undergo testing and it will still need to be validated. So it's not a quick fix. We may be lucky and find trials and vaccines being tried out towards the end of the year, but it could take 18 months or more for a vaccine to be in wide circulation and use.
Lovely. Kate, thanks very much indeed. The last question that we're going to address in today's session would appear certainly short. It's definitely not simple. And the question is, when would it be safe to travel again? It is very complex in terms of understanding how the world is going to change and how we then react. We've seen in China that domestic travel has already started to return. There are reports that domestic travel in China is potentially at 50 or 60% of its pre-COVID-19 levels, which is an amazing return. But if you balance that with the fact that in Beijing, we're still seeing individuals arriving in Beijing and even individuals leaving Beijing and coming back are expected to undergo 14 days isolation. It indicates that clearly it's not quite business as usual. But it also will then see the trend likely to come back on a local basis, and it'll include public transportation and potentially transportation running on a reduced capacity. When, as an organization, you start to look at when can your workforce start to travel, I guess you firstly have to answer the question of when will you return to work and the considerations around what returning to work means. We need to be cautious about understanding how timing fits in with the situation your office is in, the environment that your office is in, how it works within its own community, how your staff can travel to and from the office, and what local legislation is being committed to at that point in time. Then the fitness of your workforce, and can you manage the environment, especially with the vulnerable staff, and can they cope the situation there is at that time? Is there testing, and has testing been deployed within your community? And what is the level of immunity, and how does immunity affect whether you're able to get back and return to work? Then there's job profiling and the relative risk staff are exposed to, and have you been able to maintain distancing? Are there still distancing regulations? What's the public environment look like, and what are travel demands and the wider risk of exposure to the workforce? Secondly, you come down then to the resumption of travel environment, and it's significantly dependent on the regulatory situation across governments, and this is both in your home country, but as well as in your destination country. It's also dependent on airlines, and we've seen a lot of airlines terminating services, considerably reduced activity across the airline environment, and to a large degree hubs that would allow your staff to travel from one continent to another being stopped in terms of their activity. So the ability to travel to a destination via a third location is challenged, and it's going to be challenged by the limitations and restrictions in that country as well. It's also going to be influenced by the health officials in each country and how they deem and where they feel they are relative to the pandemic curve and the implementation of measures that they have applied at the time. There are the commercial requirements, the personal risk and destination risk, and it's important also to source reliable, trusted information as you start planning this return to business travel. And as I iterated earlier on, we are very much moving to a business as unexpected model as opposed to a business as usual model. Airlines are clearly making every effort to help us get back to an international travel environment. We've seen a number of airlines over the past week starting to do pre-travel testing for passengers. They have distancing on board and they have available PPE. So International SOS has been fully aligned with partnering our corporate clients and our organizations that we're working with to try and find ways to get people back to work. And it's really critical from our point of view as well as from your point of view. We're looking at establishing new models of working around providing emotional support, around hotline services, around consulting services, and also a very heightened medical advisory need, which we see likely to be a requirement for your organization to tap into the 12 to 18 months ahead as a critical part of your decision making in terms of your business continuity planning and moving around this new business world. That addresses the key questions that we wanted to take up from a frequently asked question point of view today. Clearly, do please continue to send us any questions you have. We'll be doing the updates weekly, and we're very happy to cover off key issues that you have. You also have the access and availability of our professional staff in terms of medical advisory to give you direct support relative to your own business needs. You can find more information at the internationalsos.com site. And if you haven't already seen, we've got a very detailed pandemic site within that that will give you much more information and talk about a lot of the things that Dr. Kate and I have been covering today. Thank you very much for attending. Dr. Kate, thank you for joining me today. It's been great to be on another update with you. And we'll look forward to seeing you all again, hopefully in the not too distant future. Thanks very much. Goodbye.